tell me about what has been going on in the last few years with your spine.
Well, it all started, I was having trouble with my legs, and then I would go and have injections put in my back. And they were putting injections in, but they were never checking to see what was going on in my back. And then I had a shoulder, a rotator cuff repaired, and I was in physical therapy, and the therapist was doing her job of manipulating my arm, and I kept fidgeting on the table. And she says, "Lay still, you're bothering me." And I said, I'm really having a hard time. And anyway, she recommended that I go see an orthopedist. And anyway, which I did. In fact, she made the appointment, and I went down there, and they sent me immediately to the MRI. And with the MRI, they noticed something wrong on my spine.
I see.
And it was a growth on my spine. And
tumor.
it was, yeah.
It was multiple myeloma.
Multiple myeloma.
How were you treated with that multiple myeloma? And tell me about your spine surgeries in specific.
Well, once I started the treatment for the multiple myeloma.
And that was when again? A few years back?
5 years ago.
5 years ago.
5 years ago. I was still having excruciating pains down my legs. And a doctor in Fargo recommended to go in there and do some surgery to relieve some of the pressures on the spine. And he did, and gone.
So they did what we call laminectomy. They removed back of the bone to open up the space for is that what they did?
Well, the first surgery took the tumor off.
Okay, to do that, we still have to take back of the bone off and take part of the bone off, and that is the decompression part of it. Okay.
Right. And then I continued on with my cancer treatment, which, I had the radiation, then they did the surgery, and then I started going into chemotherapy.
Did the leg pain get better after the surgery?
Yes,
good.
Much better.
What about the back pain?
Everything.
Good, everything got better.
For a short while, yeah.
What's a short while?
Oh, 6-8 months, I guess.
Okay. Yeah. So just after 6 months, the pain came back.
Right.
Same severity, or?
Yes.
Yes. Yep. And then, of course, I continued with the cancer treatment. I went down to Mayo Clinic and did their stem cell transplant. And went through all of that, and then recovered from that, and then a slow recovery. And then the pain came back. And then a doctor at Mayo Clinic says he said that he knows a neurosurgeon at Mayo Clinic that could help me. And
with again, you have obviously some additional to your multiple myeloma. You had just what we call degenerative spine disease, meaning bad back that needed to be taken care of. Material were pushing on your nerve and causing symptoms in the back and the leg. So for that reason, you saw a spine surgeon in Mayo.
You're right. Right.
What were you told then?
What I was told then is that he could go in there and work on me, and then he guaranteed that I'd start having problems again.
Okay. But did they go and open it up again for you in Mayo?
Yes.
Okay, and that was when?
Well, 3
years ago. Yeah, about 3 years ago.
Okay. Did it help you, the procedure?
About 6 months ago.
Again for 6 months.
Just a short period of time.
I want to just emphasize that, again, they did the same thing. They just opened up the space. They didn't stabilize your spine.
No.
They just opened up the space, and obviously that helps for a while. But if you are not stabilizing the spine, usually the pain and the symptoms return.
Right.
Go ahead.
And then after that surgery at Mayo, then I started, as time went by, I started feeling things in my legs, such as like bugs crawling around my ankles. And then it got up to my shin bones, and then it got up to my knees, and things were going bad. You could really sense that. other things that I noticed, that I didn't have real good control of my legs, and things just
Tripping.
progressively got worse. And
Okay.
then tripping. That was
Yeah.
afraid of falling, and my cancer's taken care of now. It's treatable. Everything's going fine there, but
Your legs
now,
are just not
physically,
right.
I'm just not right,
Okay.
and it's just all emitting from my back.
Now I'm going to turn actually to the picture here, and we are going to go. Obviously, they removed the back of the bone here. They did a laminectomy to take the pressure off. But your problem is beyond that. You have what we call spondylolisthesis here, severe disc disease, bone is on bone, is significant narrowing in the spine. Look at the contrast is gone there, and in multiple ways. So you have spinal stenosis and spondylolisthesis, degenerative diseases. Most of your symptoms correspond to this 3 level, even though you have other problem. And this generally is a treatable situation. We treat it all the time. But you told me now, just about a year ago, you saw all 3 surgeons in all 3 places. Tell me about your experience. What were you told then?
Well, by all 3 surgeons, I was told,
Including Mayo.
yeah, including Mayo, that sure they could go in and fix it, take 8-9 hours of surgery, and it will come back. That was the first one. Second one said the same story. The third one says, I don't even want to touch it, but I'll put a stimulator in there to help you with your pain.
Okay.
Is kind of what happened there. And I still have the pain.
Yeah. So
No matter
stimulation
how-
device didn't help you.
No, it didn't really help at all. It just
Still
makes me
tripping.
nauseous.
Tripping, falling, weak leg, using
Yeah.
a walker
1 to 10,
full-time.
how bad is your pain?
The what?
1 to 10, how bad is your pain generally?
Standing up, 10.
10. So you have claudication, meaning
Yeah.
when you
Yeah.
stand up and start using your leg, the pressure on the nerve make the symptoms much worse.
Yes.
This is 10 is not a livable pain.
No, it's
No.
not. It's terrible. It's
Yeah,
absolutely
and
terrible.
you just told me that even if any surgery help you 10%, you take it because this is not livable.
You're right.
Well,
Right.
we don't do surgery for 10%, and I give credit to my colleagues in all 3 places, including Mayo. Doing a big surgery like a 3-level open surgery is a 9-10 hour surgery, and it is a horrendous surgery. I just was reading a paper. Average blood loss can be up to 1.5 to 2 liters, and significant recovery. I think the only difference is that we can do that 10-hour surgery with a minimal invasive 3-level OLIF procedure. And our track record is very clear. We can do it under 1.5 to 2 hours. And the vast majority of our patients go home within a day or 2. So for us, it's a doable surgery. If you're not putting you at any higher risk, like our colleague that use only open technique, so we can do that. Now, but I think I'm a little sad about that our colleagues should know that there are those abilities out there. If they cannot do that, they should know that other people are trained
They
adequately
did
and
not
able to do.
refer us here. Any of those providers did not refer us
Yeah.
here to tell us there were more options. We found through a friend who came
Yeah.
here
Yeah.
to this facility. So
and
our
he's
friend
fine.
had very good
He's fine.
results.
So tell me
Yes.
about your friend. What did we do for your
Dick-
friend?
Uh,
No, don't know names.
No names. Yeah. But anyway, my friend,
Mhm.
he had problems with, his was just one leg. And
He's 85
80,
years old.
85, and yeah.
Yeah.
And I would say maybe when he was 80, he came to see you. And anyway, he's just absolutely perfect.
Excellent. Well, I'm happy to hear that. And this, our ability to do this kind of surgery, you just summed it up, and especially elderly, nobody would do a 9-hour surgery on a.
No.
But we did that surgery as well under 1.5 hour, and everybody, even in older age, we can tolerate that. If the blood loss is not a lot, if the time of the surgery is not a lot, we can tolerate that, and that is really what we are able to do to make a big surgery a small surgery.
Sure.
And and there are lots of places in the United States as well. These advanced techniques are offered. And I see that sadly that instead of telling patient we cannot do that. Go rather to this place. This is the place. They should know that because we have contacted them. We have told them what we are doing. Rather than they just tell you go home and live with it.
Right.
And I think that is that saddens me. Now, any question otherwise for me or any
No,
comment?
we really appreciate your time and expertise.
Thank you. I appreciate that. I appreciate